Hello, everyone. This is Dr. Sami from the Biostatistics Learning Group. So, in this session, we will um, complete and carry on from the last session. So, parent study, and we're talking about secondary data analysis. Parent study primary investigators, PIs, have tasks that differ from investigators using an existing data set. Parent study PIs, Table 1, have the ability to prospectively determine study variables, subject recruitment strategies, and other research protocols. Recruitment of study subjects might be able to be extended until the number meets or exceed those called for in the power analysis. When using existing dataset, a PI is unable to prospectively engage in these activities and is thus faced with different challenges relevant to working with a dataset. One of the most important challenges faced by a PI using an existing dataset is associated with selecting a dataset that is a good fit for the research questions. A subsequent section further discusses dataset selection strategies. So advantages and disadvantages of using an existing dataset. Good science is about finding credible answers to important research questions. Many research questions can be answered well by using an existing dataset or by engaging in a prospectively research or a prospective research study. It has been erroneously implied that research using an existing dataset is inherently more suspect than other research. It's highly preferable to answer research questions using an existing dataset if one is available to answer the research questions. This is preferable for several reasons. First, use of an existing dataset tends to save a great deal of time as opposed to designing a new research protocol to recruit subjects and gather data. This benefit of obtaining results more quickly is especially true for longitudinal studies, in which subjects need not only be recruited, but is also followed over months or years. Second, it tends to be much less expensive to use data that has already been collected. Third, as most prospective research studies include at least some level of risk to the subject, a researcher using an existing dataset has the benefit of not putting subjects in harm's way, as those subjects have already experienced any burden associated with participating in the research. Table 2 contains several successful examples of researchers using an existing dataset to answer new research questions. And here is Table 2. Examples of secondary data analysis. Investigator name of parent study, design or year number, sample research question, intervention key, items assessed, and results. Alrighty, so example one, parent study. They did screening and brief intervention for drug use in primary care. It's called the Aspire RCT. So it was an RCT 2014 number they had is 5 to 8. Sample patients who screened positive for illicit drug use at an urban primary care clinic in Boston. Research question to test the efficacy of two brief counseling interventions for unhealthy drug use. Intervention, a brief negotiated interview, and an adaptation of motivational interviewing compared with no brief intervention. They assessed main drug use and severity of drug use, alcohol, smoking, and substance involvement at baseline and at 6 months. Results, brief interventions did not have efficacy for decreasing unhealthy drug use in primary care patients identified by screening. Study 2. This is the parent study, and now comes the secondary analysis. So they did it, their research is changes in health outcomes as a function of abstinence and reduction in illicit psychoactive drug use. One more time, changes in health outcomes as a function of abstinence, and reduction of an illicit psychoactive drug use. Prospective study in primary care. So, design year number, it was a statistical analysis using ANOVA for descriptive statistics. And for advanced statistics, they used Spearman's correlation. And linear regression models. 2015, 5 to 8, same subjects. Sample is the same as the above. Research question is test the association between longitudinal illicit drug use patterns, including abstinence, and health outcomes. To test whether these associations vary by drug type among illicit drug users in primary care. The intervention and key items associated are same as above. The results, abstinent but not decrease drug use without abstinence, was associated with improvement in drug use consequences compared to those with continued or increased drug use. This relationship was found among those whose main drug was cocaine and opioids, but not marijuana. Thank you so much for your time, and we will see you in the next session.